Some of the misconceptions that exist about Black women as they're seeking healthcare is that we are uneducated.
If I'm not seeing a provider of color, I expect to be treated poorly.
As Black people, we have very unique experiences, especially living within the context of the United States, that ultimately impacts our health and our health outcomes.
When it comes to navigating healthcare as a Black woman, some of the lessons I learned growing up were really an outgrowth of my mother's experience. She had chronic asthma. And so one of the key things she taught me was you have to kind of really articulate your symptoms, say that your pain is a 10, make them take you seriously, because otherwise, a lot of bias comes into your experience.
I was working for an academic medical center, and in one of the departments that I worked in, the environment was really toxic. I was dealing with racism, microaggressions, and I found myself breaking out in chronic hives on a daily basis, to the point that I would sometimes have to leave work and go home. And so I went to see an allergist. She was a great, pleasant doctor. She was a white woman as well. And she ran a bunch of tests on me to see what I was allergic to. And the tests, everything came back showing that I wasn't severely allergic to anything. And then when I left the job, the toxic job, the chronic hives stopped happening. So I realized that it was the stress of being in that work environment that was triggering these hives. I remember reflecting on that experience and thinking that if I felt like my doctor as a white woman would understand the experience of dealing with racism at work and microaggressions, that I might have naturally shared with her what was going on at work. But because I didn't think she would relate or understand, it just never came up.
When it comes to the birth of my first child, that experience was pretty tough. Even in trying to ask questions and seek out information, I was repeatedly marginalized, told, oh, you don't need to know that. You don't need to worry about that. I think I would have benefited from more of an informational approach, more of these are your options, and more of we're respectful of, the kind of care that you would like.
We curated a provider network of providers of color. That's not to say that Black patients should only be seen by by Black doctors, but we wanted to make it easier for Black women to find those types of providers, and that's why we built our platform. It felt important for them to also have a community where they can ask other Black women, like, hey, I got diagnosed with breast cancer, and these are the options that my doctor shared with me. Has anyone else gone through this? What will I look like once I undergo this procedure? And so we brought all of those components into one platform to support Black women as it relates to anything related to healthcare, whether it's finding providers, finding information, or finding community to navigate a health journey.
My vision for Health in Our Hue is that we become the first stop for all Black women and women of color when they have any question about their health or want to seek information for their health. Ultimately, we want to impact all 50 million of these women in this country. And so we're just at the beginning of that journey and are excited to continue.